morning. Thank you for joining us. This is the weekly media briefing and public health update with Montgomery County Executive Mark Ulrich. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government. And joining us today is Dr. Keisha Davis, who is our health officer, Dr. James Bridgers, Director of the Department of Health and Human Services, as well as Ms. Luisa Cardona, Assistant Chief Administrative Officer. Our guest this morning is Mr. George Escobar, Incoming Executive Director for CASA. Thank you, everyone, for joining us. Mr. County Executive, the floor is yours.
Good morning, everybody. Thanks for joining again this week. I think everybody knows CASA is pretty well known for their work on behalf of immigrants, and they've been a long-time trusted resource in the immigrant community. This year, the world got a glimpse of how important they are during the Kilmar-Abrego-Garcia case. While this case received the most media attention, it is a small fraction of what CASA has been doing all along to ensure that all immigrants receive due process in this nation. However, legal advocacy on behalf of immigrants is far from their only role in the county and throughout the region. CASA has also been critical to provide education, job training, resources, and a helping hand to those who arrive in our communities. They help families in many different ways, from providing tax preparation. Yes, these folks do pay taxes, Donald Trump. Helping to develop youth leadership and assisting families through citizenship processes. What isn't talked about enough is CASA's work on behalf of those who aren't immigrants, native-born U.S. citizens, workers, tenants, those facing injustice, and those in need of a voice at all levels of government. Our long fight to increase the minimum wage and provide rent stabilization across Montgomery County could not have been accomplished without the advocacy work of CASA in the process. Last week's Trust Ask press conference was the public's first chance to hear from the new leader of CASA, George Escobar. I have to say, George, welcome aboard. I will always miss Gustavo. I had a relationship, I think, of almost 40 years with him. So it's a long time, but your organization has been really critical in Montgomery County for a long time. And if you stand in an organization now that is really one of the prominent organizations, not just in Montgomery County, but around the region and beyond. George, you've been with CASA for many years yourself, and the transition, I'm sure, is going to be smooth. And you're taking over at a time, though, when there's increased fear within the immigrant community that's driving many people away from community engagements, and in some cases, towards self-deportation. There is no way for anyone in our community to live. This is just not the way that people should be treated, particularly when almost everybody that ICE is arresting are people with no criminal records. These folks are living here, they work, they pay taxes, they contribute to our community in many, many ways. And I think all of us, if you just take a look around Montgomery County and imagine what happens if these folks are deported, you would be in a very different county, and you would have a lot less services and things that you need today. So it is not something that we should take lightly or ignore. George is here to join me on the media briefing and talk about what he's seeing on a daily basis now that we're nearly 1 year into this second term of the Trump administration. And George, thank you for joining us.
Thank you so much, County Executive. Really appreciate the welcome. Really appreciate the opportunity to talk to residents and to join your press conference today, or your press briefing today. First of all, it goes without saying that it's the biggest honor of my life to be selected as the next executive director at CASA. You know, just recently, you mentioned Gustavo Torres. Just recently, we celebrated our 40-year anniversary in our Baltimore office, and we're fortunate enough to have many of the people you see here join us there, including yourself, Mr. County Executive. And we were very honored by your presence, and thank you so much for being there. And we really used the moment to recognize the retirement of Gustavo Torres. For over those 40 years, Gustavo had been the lead of our organization, our executive director, for more than 34 of them. So obviously he led the organization, transformed it from what it originally was. And it was a small nonprofit working in a church basement in Tacoma Park, by the way, into what it is today, one of the largest immigrant serving and advocacy organizations in the Mid-Atlantic region. And obviously that growth, that partnership could have never happened without Montgomery County. Montgomery County has always been there, and has for the longest time really been the home to our organization. Through our entire growth, we consistently partnered with county leadership on all kinds of initiatives that made our residents, that prepared our residents for success, that helped them through crises, that took them through to progressive victories. You mentioned a couple yourself, but in the end, through the partnership that both CASA and Montgomery County have had, we've modeled what can be done statewide. We've modeled what can be done nationwide to treat our immigrant community with dignity, to treat our immigrant community as the real power behind the growth of our county itself. If you go back to remember one of our first victories when we fought for and got at the state level the DREAM Act, right? Allowing anybody, regardless of immigration status, an opportunity to pursue their educational goals and ambitions in state schools. The primary leaders and drivers of that victory were Montgomery County youth who were marching down the streets in Montgomery County, again, modeling what can be done statewide. We saw, of course, you mentioned a couple of them itself, the increase of the minimum wage law, which we were honored to have you announce at our employment center. Again, something that has been a model statewide. And you mentioned just recently something also that we hope is a model in which we can model for the rest of the state and the rest of the country is our Trust Act. Again, a Trust Act that's being introduced right now as we speak in the council is something that's been championed by Montgomery County leadership and something that actually has already been through executive order the way in which the county has operated. But now through this codification, we're going to ensure that regardless of who our leadership is in Montgomery County, we will continue to treat immigrants with dignity, with respect, regardless of who is in control of the federal government at that particular time. So yet again, this is another example of a partnership between CASA and Montgomery County in which we're modeling how to treat our communities with respect, with dignity, and hoping that these are models that can be replicated throughout the state and in fact throughout the country. And again, to reiterate, over the years, it's just been an honor to partner with the county in a variety of initiatives. We talked a little bit about those victories, but also important to note, as you mentioned, County Executive, we've been partnering with the county for a very long time to provide a number of high quality services, partnering with you throughout the pandemic to ensure people had access, for example, to vaccines, and people were educated and understood how to navigate those systems and be able to understand the value in being vaccinated. If you remember all of the negative information that was out there before about those vaccines, we were able to partner with you all and to create culturally proficient messages to ensure that the Latino community and our immigrant community understood how to receive those vaccines and indeed access them, right? Again, many times throughout from the foundation of our organization, we were always fighting for and providing services to those who are most vulnerable in our community. And many of those individuals are day laborers, and those are individuals that seek work opportunities in street corners. And ever since we first started working together, we found ways to, again, provide access to those employment opportunities for those vulnerable individuals to make sure that they're not being victimized by wage theft, make sure that they're seeking work in a dignified area, in a dignified space, making sure that they understand their rights regardless of their immigration status, making sure that they're not subject to wage theft, and also partnering with you to provide them legal services. And of course, a lot of folks know about our immigration legal services, and this is a high need right now, especially what we're seeing at the federal level. But important to note, as you mentioned, we have done a lot of work together to ensure that our residents in our apartment buildings understand their rights and understand how to fight back against illegal evictions, that understand how to fight back against wage theft. So both in employment and the housing sphere, we've made significant progress, not only in providing quality services to folks that are most vulnerable, but also ensuring that we're creating policies and legislation that is protecting and cementing those rights. And those are just a couple of examples, of course, and you mentioned a couple of others, County Executive, in terms of our work helping people pay their taxes. As you said, yes, we have to remember that in the media, our immigrant community is portrayed as a community that's only coming here to request benefits or to try to empty state coffers, requesting services. But at the same time, what is little known is the billions and trillions of dollars that our undocumented community provides through the taxes that they file on a yearly basis. And we provide tax assistance for folks to help them file the taxes so that they can demonstrate their good moral character in this society, and that could eventually help them towards a path of regularization, right? And of course, helping eligible legal permanent residents navigate the complicated path to citizenship as well. And we've come together to come up with some very innovative programs that help those lower income individuals that have to pay a lot of money in legal fees and have to pay a lot of fees in general to DHS to file for their citizenship, which is, and many times has been the biggest obstacle that they face. We've partnered on a number of initiatives in which we can help those individuals access those services and access those fees in an affordable manner. So on and on and on. Really, we have always been. We've always, within the organization, I've always thought we've been blessed to grow within and be hosted by Montgomery County. And to this day, it's really difficult to talk about CASA without talking about Montgomery County. And I hope you all feel the same about us as well. So thank you so much for the opportunity to talk a little bit about us, our organization. I'm obviously very excited about the next path forward as we move forward with the organization. As you mentioned, right now is a very, very trying time for our community. Literally, people are being kidnapped off the street. They're afraid to walk to school. They're afraid to go to the grocery store. This is a moment of a seminal moment in the history of our community, and it's something that we take very seriously. We're thankful for partnerships with progressive governments such as Montgomery County that really see individuals for who they are and take the responsibility of understanding that they represent all of Montgomery County residents, regardless of their immigration status. That is not the case in many counties and many areas in the rest of the country. And right now is really the moment in which is our opportunity to show, to really underline what our principles and values are, and translate those into legislation, translate those into things that can be codified and things that can be sustained over the long term, which I think the Trust Act, for example, is a vital example, is a prime example of how to do that over the long term. So again, thank you so much for the time here, and I look forward to answering any questions folks have.
Thank you.
I was just going to say, I think that one of the first things I remember working with CASA on was you had a day laborer site in Langley Park, and it was insecure, and it was the middle of the parking lot of a 7-Eleven. 7-Eleven hated it. The police weren't fond of it. Prince George's County wasn't thrilled. And Tacoma Park, where I was on the council then, we found a site on New Hampshire Avenue where you could have a proper day laborer center in a place where everybody was secure and you could conduct business in a good way. And I thought it was one of the first bits of cooperation. I remember that early on. And I remember the church, Tacoma Park Presbyterian, where your first offices were. So we go back a long ways.
Absolutely, County Executive, and one of the wonderful things is not only did that space there really provide again a dignified way in which itinerant workers could look for employment opportunities. But thanks to partnerships we had with Montgomery County, we also started partnering with, for example, Montgomery County College to vocational training in those facilities where folks, regardless of where they're coming from, what language they speak, who they are, they have the opportunity to build skills, and not only find work opportunities in the lower wage spaces, but also have an opportunity while they participate with our joint programs, get certified as a plumber, as a carpenter, whatever, through Montgomery College. So that was another example of how we've always been innovative in trying to find ways to work together with folks, help them on a path to create more income, help them on a path to learn new skills, and help them on a path to contribute greater to the community they live in and that they love.
Okay, I'll just say the last time I saw you was up at the new training center, and that's that one I'd point out, because if you were in the room, you would see that this was not all Latinos getting trained. It was people who've come to this country from all over the world who were in there getting trained, and it was really, I think people associate you only with the Latino community when in fact it's much broader than that, and you've become kind of a beacon for all the immigrant groups that come here and people looking to get job training and entering the workforce. You've got enough of a reputation that people seek you out for doing that. So I just want to highlight that too.
Absolutely. Thank you so much. Yeah, obviously, and it also shows the diversity of our county itself, right? Fully about 40% of our folks that participate in our vocational training and employment programs are coming from West African countries, Francophone West African countries. And many of them, over half of them, have actually degrees from their home countries. So that's another misnomer and a misinterpretation of who our immigrant community is. Many of these folks, some of them are dentists, doctors. Some of them have master's degrees coming from their countries of origin, in Cameroon, in Togo, and are highly educated folks. But when they come here, their only opportunities are day labor. But they immediately respond to opportunities where they can demonstrate their skills, where they can learn a new skill. And immediately, and as a result, participate very significantly in a lot of these programs. So again, just shows who our community is, and shows how skilled they are, and how willing they are to make a contribution to our community.
Thank you, Mr. Escobar. Let's see if the members of the media have any questions. Well, I see Judy from the Greater Olney News has her hand up. Good afternoon, Judy.
Good afternoon. Mr. Escobar, a lot of my readers have been asking me, they're hearing all the stories about ICE swooping in and, sort of absconding with people. They're asking me if you are hearing, if anyone is hearing of incidents in places of worship where ICE might be entering. I think they're afraid to go and worship because it's such an sort of an open venue, and they're a little bit frightened. Are you hearing of that happening in synagogues or mosques or churches or?
No, thanks for that question. I think this brings up a really important question that many people talk about. Their fear of ICE coming into these areas. I'll be honest when I say to you, we have been doing a lot of training with, for example, community service providers, faith leaders, about how to ensure that ICE follows the law if they enter their spaces, right? Ensure that places, we're not asking them to violate the law in any ways. On the contrary, we're asking them to exercise their rights, and in terms of keeping areas that are not public, private, right? Keep your access ways very, ensure that there aren't multiple entries to a particular space, et cetera, right? Understanding your rights in terms of designating areas as private in your particular areas, right? That's number one. We've been doing a lot of training. A lot of people have been learning about that. That work is ongoing. I'll tell you that we don't see a high number of incidents where ICE enters the spaces, but you got to remember that how do you get to that place, right? ICE is hunting people as they travel to these areas immediately adjacent to these areas, whether they're clinics, whether they're even grocery stores, whether they're areas of faith. We do believe ICE is attempting to create ways in which they can exercise some operations for folks that are going to these areas, right? This is why it's very important for people to be educated on their rights, about how to interact with law enforcement outside on the street. And this is really important for folks to have to really be educated on understand what their rights are when they engage with the law enforcement official outside, when to exercise their right to remain silent, when to exercise their right to request an attorney, etc. Right? Because regardless of where it happens, it is something very important for folks to understand. But we do not see a large number of incidents where we're seeing ICE actually enter these spaces. I'll argue that they don't need to, right? They have other ways to cause that type of fear, and they have other ways to be able to intimidate people in that kind of a way, right? So I think that's why on our side, our priority is just educating folks and helping them understand their rights in different spaces, whether they're inside a particular space or whether they're outside on the street.
Thank you very much.
Judy, members of the media, any additional questions for Mr. Escobar this morning? Still 11:59. Any additional questions? Well, Mr. Escobar, you can remain on this call, but if you need to depart, please feel free to do so. Mr. County Executive, back to you.
Okay, thank you again, George. Yesterday, the Bracken Square Apartments in Silver Spring opened. It's a 98-unit mixed-income building. The building comprises the following unit layout for affordable household. That's affordable to households. It has 28 one-bedroom units. It has 55 two-bedroom units and 15 three-bedroom units. Three-bedroom units are really hard to find in the county, and the preference for many developers is one-bedroom units. So this is a really good mix of units, and we expect these units to be snapped up pretty quickly. The project benefited from our efforts to streamline county development approvals and was the first to use our speed to market initiative. So it's good to be back and see how these efforts have borne fruit for the community. I'm glad to stand with Delegate Laura Charkoudian and Councilmember Kate Stewart, who are there, because this development shows that we can accomplish a lot when we're able to leverage the right state and county partnerships. And we maximize the use of financing, including low-income tax credit. And Bracken Square employed a very innovative, what they call twinning approach, where they're able to leverage 4% and 9% tax credits to fund the development. And this method really allows us to stretch public dollars further than they would otherwise go. Under our director, Scott Bruton, the county's Department of Housing and Community Affairs did its part to invest in key financing of this project, about $9.5 million in lending from the Housing Initiative Fund and a pilot agreement. We're nearing the end of 2025, and it's been another historic year for the county's investments in affordable housing. Since FY23, we've created and preserved more than 4,500 affordable units, and in FY25, we closed financing totaling $108 million to support the creation or preservation of more than 1,800 units countywide. These investments reflect our values, and access to affordable housing is about stability and dignity, and also opportunity. By stepping in when we did and working with partners like TM Associates and Green Street Housing, we were able to keep our residents from being priced out of their homes. We value the community we built here, and accomplishments like this help us keep residents here where they want to be. In other news, Attorney General Brown sues HUD over their policy that could force thousands of Marylanders into homelessness. It's one thing about the Trump administration, really egregious things just keep coming. It's something seems like you can count on daily. Just after the federal shutdown ended, Maryland Attorney General Brown took action to protect thousands of people in danger of feeling the impact of severe cuts to social services. Every year, the federal government issues a notice of funding opportunity for the Continuum of Care program. It's a grant program. That money is routinely used by Montgomery County for permanent housing to keep people who experience homelessness from having to sleep outside. In other words, losing this money means that hundreds are at risk of losing their homes. Last number I heard, about 500 households, over 800 people. Maryland's one of 21 states that filed a lawsuit to keep the funding in place. But just yesterday, the government withdrew the opportunity for funding to redefine the parameters of how communities qualify for the money. One thing that stood out to me from their proposals, I've been briefed about how these changes would punish communities for sharing life-saving drugs like Narcan with homeless program participants. This proposal is especially sick and twisted. And why, you might ask? Well, it would make it a criminal offense for one of the workers in the homeless shelter to administer Narcan to a person who'd overdosed on fentanyl. They would be committing a crime. I'm sure you're all logical, so you're probably saying, what crime are you committing? Well, you're committing the crime of encouraging addiction and drug use. You're probably wondering how saving someone's life encourages addiction. Well, this is the way it works. If you let a person die, you've cured their addiction because they're no longer addicted to drugs and no longer pursuing drugs. Of course, they're dead, but they're not pursuing drugs anymore. So mission accomplished. If you save the person, and since Narcan is not a cure for addiction, then the person may return to using drugs. And so in this twisted logic, the person who administers Narcan is enabling the person who overdosed but has now survived to use drugs again. Therefore, you're encouraging them to use drugs. Therefore, you're committing a crime. There is another outcome that happens, which is people get treatment and they recover from their addiction and become functioning and productive members of society. In the Trump mind, just to let them die is the cure. Just like his proposals to end homelessness, where they will put thousands of people out on the street, will actually end in, more people dying. Ending funding to end and prevent homelessness is considered a waste of money in his mind, when you can simply leave them homeless, tell them, don't look to us for help, just get a job. They don't make no acknowledgement that people might be struggling with mental health issues, or that something happened like a car repair that they had to pay, which meant they didn't have the money to fix the car, which means they couldn't get to work, which means they lost their job, and they're out on the streets trying to get themselves stabilized again and back to work and back to getting, a job and supporting their families. He takes none of that into account. Our programs work to move people from homelessness to homes while helping them deal with mental health issues or their lack of skills. Our programs work, and his approach, apparently the Republican Party's approach, is to just let them die. America's never had a leader so insensitive and depraved as this one. Turning your back on the needy is antithetical to our society's values and to the values of all major religions, where the concept of healing the sick, feeding the hungry, and housing the unsheltered, does that sound familiar? These are kind of central to their teachings. It's kind of central to living in a civilized society. You can't simply ignore the cruelty behind these changes and their attempt to vilify a county like ours, which is trying to help everyone succeed. These changes ignore the facts that providing housing dramatically increases the chances of long-term stability and success in voluntary treatment services for those experiencing homelessness. Congress never weighed in on these changes. They're simply at the directive of the Trump administration, which looks to cap continuing of care funding dedicated to permanent housing at 30% and 90% of available money. I hope the pressure from the lawsuit forces leaders to reconsider their approach and consider the difficult position it puts many of our residents in. Speaking of putting people in difficult positions, you can also never doubt that the Secretary Kennedy will find ways of making life more difficult and painful. Last week, a panel of Trump-backed vaccine advisors, meaning they're not qualified to be advisors, voted to end the recommendation for the first dose of hepatitis B vaccine that was to be given within the first 24 hours of birth. That recommendation has been in place since 1991, and since its start, hepatitis B infections in children and teens has decreased by 99%. On Friday, the Maryland Department of Health issued an advisory emphasizing the importance of administering the birth dose of hepatitis B. It follows the same guidelines put out by the American Academy of Pediatrics. In alignment, Secretary of Health Dr. Shishamani has issued a statewide hepatitis B vaccination standing order that authorizes qualified health professionals to administer the vaccine. This is yet another example of how our State Department of Health won't sit idly by while dangerous recommendations and plans are implemented. It's also another example of placing a completely unqualified and delusional person in charge of a federal agency, this time the agency that is there to promote our health. This is not good. Hepatitis B is a liver infection that spreads through direct contact with bodily fluids and can lead to severe liver conditions like cancer or liver failure. Public health experts worry that the vote could raise unfounded safety concerns about the vaccine and encourage some people to opt out of it, potentially leading to an increase in illnesses in the population. The change is not based on science, but on uncertainty. Doctors in the medical profession are pretty certain about this. The uncertainty is in the mind of a man who doesn't know what he's doing. I can't believe someone would try and argue that our world would be safer and less susceptible to disease by eliminating tried and true projections. I'm glad that in Maryland, doctors and nurses will be reassured that proper medical guidance is still being offered and encouraged for our parents of newborns. This is a good time to get an update from our health teams and our other county leaders. So I'm going to turn this over to Dr. Davis and give you a chance to go first.
Thank you, Mr. County Executive. I appreciate the emphasis on hepatitis B. I will just remind folks hepatitis B is an infection that affects the liver. It can show up both acutely, which is short-lived, or chronic, and it can be very harmful for babies. About 90% of babies who are infected with hepatitis B will go on to have lifelong illness. That is very concerning, especially because it can be prevented very early by giving that first dose, which is given within 24 hours. So usually while they are still in the hospital. I think, people may wonder, well, why do we give babies this dose so early? Can't it wait? And that's what we used to do. So prior to 1991, when this became a universal recommendation, the vaccine was given only to those who where the mother tested positive, which is still recommended, or if you didn't know, or would wait until the baby was 1 or 2 months. And we still continue to see infections, tens of thousands of infections of hepatitis B. And since we have converted to giving that birth dose, so within 24 hours of birth, when babies get that, we have seen the number of hepatitis B cases in children and teens to drop by 99%, essentially eliminating it. That is amazing because not only does it prevent the acute or chronic hepatitis infection, but hepatitis B can go on to give liver disease, liver cancer, cirrhosis, and can cause many complications for folks. The Maryland Secretary of Health and the Maryland Department of Health have been very proactive in this and issuing a standing order that allows any healthcare professional to give the dose. That does not supersede insurance recommendations, so it doesn't ensure that insurance will cover it, but it is able to be given. It's also important to know that the ACIP, the advisory committee, has given a recommendation to the CDC. That recommendation still needs to be formally approved through the processes, so we expect that that will happen. I think it's important to remember that all of the major medical associations, the American Academy of Pediatrics, the American Medical Association, the American Association of Family Physicians, all agree on continuing to give that birth dose. And I appreciate what the State Department of Health has done to encourage and continue to make that available to newborns while they are still in the hospital. On other vaccine initiatives, we continue in the state to be supportive of vaccination and continue to cover vaccinations based on the childhood vaccination schedule that was in place as of December of 2024. That is important because all of the changes that have happened this year under this new advisory committee, Maryland, the state, is following the vaccine schedule from before all of these changes were made, which I think, again, just speaks to the strong commitment that the state has had towards vaccination and the importance that we see in health that it makes for all of our residents. Just on a separate note for health in general, we are starting to see that uptick in flu. So it's a good time to get your flu shot, and COVID if you haven't already. 'Tis the season for flu, especially as folks are going inside more and the weather starts to turn. So we are seeing that in the community. The hospitals are still very well prepared, but don't be surprised if you come across somebody who is sick. We are starting to see those things tick up. So take precautions in all of the family and community gatherings that are going to be coming up in this season. And with that, I will turn it over to Dr. Bridgers.
Thank you, Dr. Davis. And the only thing that I will add is that within the Department of Health and Human Services, as you always push as well, is that our mental health matters to our countyans. Help continues to be within reach. Our 988 number and our mobile crises outreach team and our crisis center number, which is 240-777-4000, still is available for those who may be in need. So I just wanted to add that to your update with our Health and Human Service, for our Health and Human Services this afternoon.
All right. Thank you, Dr. Bridgers and Dr. Davis, for your remarks this afternoon. Members of the media, any questions, additional questions for the county executive or Assistant Chief Administrative Officer, Ms. Cardona, or for the health team this afternoon? Please raise your hands. I see Talia Varelas from Univision DC. Go ahead, Talia. And again, you can ask questions in a bilingual way. If you like a soundbite in Spanish, Luis Cardona is here.
Okay, perfect. Thank you so much for your time and for taking my question. Going back to what the future executive president of CASA mentioned about the efforts to educate the community when it comes to establishments and things like that in ICE. If I can get that answer in Spanish, pretty much about the efforts and what is being done to educate the community and protect them from situations with ICE.
Me, right? Because George is off. Sorry, Lorna, just confirming. Okay.
Absolutely. Yes. Go ahead.
Sí, organizaciones como CASA están trabajando mano a mano con varios grupos en nuestra comunidad, incluyendo las iglesias, para proveer información sobre los derechos y sobre dónde accesar, qué espacios son públicos puesto a cuáles son privados, porque eso puede ser una manera de tener un poquito de defensa contra emigración cuando están tratando de entrar. Entonces, organizaciones como CASA están ahí haciendo esta información pública.
Talia, does that cover for you?
Yeah, and then just a follow-up, how frequent are you seeing this being an issue where ICE agents actually try to go into private establishments?
Por el momento, en nuestra comunidad de Montgomery County no estamos viendo esto con frecuencia, pero estamos mirando lo que ha pasado en Chicago, en Louisiana, en Charlotte, y sabemos que hay un potencial muy alto que cuando tengan más agentes aquí localmente, vamos a ver una incrementación de estos tipos de actividades.
Perfect. Thank you so much.
Thank you, Talia. Members of the media, any additional questions this afternoon? Or questions?
If I may, if there are no questions, I did want to first say thank you. I really appreciated George being here. I actually came up with CASA. I worked at 6 a.m., 5 a.m. doing Know Your Rights presentations at CASA. And I really appreciate what they teach people about advocacy. It taught me that being a lawyer is much more when you're truly trying to be an advocate. I also just wanted to remind everyone that our Montgomery Gives Local campaign is still ongoing. Today, thanks to the county executive, our office actually kind of looks like Santa's workshop because we, as the staff on the executive floor, have all participate in donations to help families who cannot give toys to their children or to buy themselves presents this year. And so we are participating in local giving as well, and just want to encourage and remind everyone here, including the media, even if it's you participating, please use the hashtag Montgomery Gives Local. Our local giving campaign continues and will continue through beyond this year because we know that the need is rising. Thank you.
Thank you so much, Ms. Cardona. No more questions, members of the media? No additional questions? Well, I think we're done for today. Thank you, everyone, for joining us. Thank you, Mr. County Executive. Stay safe. We'll see you next time. Have a great afternoon.